Your body has been screaming at you for months. Maybe even years. And you've been ignoring it. What if I told you that feeling you brush off as just being tired could be your body's desperate attempt to warn you about diabetes? The truth is terrifying. By the time most people get diagnosed with diabetes, they've been living with it for an average of 7 years. 7 years of damage. 7 years of missed warnings. 7 years that could have been prevented. Right now, as you're watching this, your body might be sending you signals. Signals you think are completely normal. Signals you've learned to live with. But here's what doctors don't tell you until it's too late. These aren't normal. They're red flags. And ignoring them could cost you everything. I'm going to walk you through 7 signs that seem innocent but are actually your body's way of telling you something is seriously wrong. Some of these will shock you. Some you're probably experiencing right now. And by the end of this video, you'll know exactly what to look for and what to do about it. Because knowledge isn't just power here. It's literally life-changing. Let's start with something you probably do every single day without thinking twice. You wake up in the middle of the night to use the bathroom. Once, maybe twice. You tell yourself it's because you drank too much water before bed. Or maybe you're just getting older. Everyone does this, right? Wrong. This is one of the earliest and most ignored signs of diabetes. When your blood sugar levels are too high, your kidneys go into overdrive trying to filter out the excess glucose. They pull water from your tissues to dilute the sugar, and that water has to go somewhere. The result? You're making constant trips to the bathroom, especially at night. But here's where it gets worse. Most people don't connect the dots. They don't realize that waking up to pee isn't just annoying. It's a symptom. And when you ignore this symptom, you're giving diabetes more time to damage your kidneys, your eyes, your nerves, and your heart. The scary part? This can happen for years before you ever feel sick enough to see a doctor. Years of silent damage while you think you just have a small bladder. Now let's talk about something even more common. You're constantly thirsty. Not just after exercise or on a hot day. I'm talking about that nagging thirst that never really goes away. You drink water, juice, soda, whatever you can find. And 20 minutes later, you're thirsty again. Sound familiar? This isn't your body asking for more water. This is your body desperately trying to flush out excess sugar through your urine. It's a vicious cycle. High blood sugar makes you pee more. Peeing more makes you dehydrated. Dehydration makes you thirsty. And round you go. What makes this particularly dangerous is how easy it is to dismiss. We live in a culture that tells us to drink more water. So when you're constantly thirsty, you think you're just being healthy by drinking all the time. You pat yourself on the back for staying hydrated. Meanwhile, your pancreas is struggling to produce enough insulin, and your blood sugar is climbing higher every single day. The truth is brutal. If you're drinking way more than usual and still feeling thirsty, that's not normal hydration. That's a warning sign. Here's where things get really interesting. Number 3 on our list is something that affects millions of people who have no idea it's connected to diabetes. Blurry vision. You probably think you just need glasses. Or maybe you've been staring at screens too much. That's what most people assume. They book an eye exam, get a prescription, and move on with their life. But blurry vision can be one of the first signs that your blood sugar is out of control. High glucose levels cause the lens in your eye to swell. This changes its shape and affects your ability to focus. The terrifying part? This can happen before you have any other obvious symptoms. What's even worse is that this kind of vision change can come and go. Some days your vision is fine. Other days everything looks fuzzy. This inconsistency makes it even easier to ignore. You think it's just stress or fatigue. But your eyes are literally being damaged by excess sugar in your bloodstream. And if you wait too long, this damage can become permanent. Diabetes is the leading cause of blindness in adults. Not because the disease is unstoppable, but because people ignore the early warnings until it's too late. Let's move on to something that might surprise you. Slow healing wounds. You get a cut, a scrape, a blister. Nothing major, but weeks go by and it's still not healed. You might notice that bruises stick around longer than they used to. Or that minor injuries just don't seem to get better. This isn't bad luck. This is your body telling you that something is interfering with its natural healing process. High blood sugar damages your blood vessels and restricts circulation. When your cells don't get enough oxygen and nutrients, they can't repair themselves properly. This is particularly dangerous for your feet. Diabetes affects the nerves in your extremities, which means you might not even feel when you have a cut or sore. Combine that with poor circulation and slow healing, and you have a recipe for serious infections. People lose toes, feet, even legs because they ignored small wounds that wouldn't heal. It sounds extreme, but it happens every single day. And it starts with something as simple as a blister that takes too long to go away. If you've noticed that your body isn't healing like it used to, don't brush it off. Get your blood sugar checked immediately. Number 5 is something almost everyone experiences but nobody connects to diabetes. Extreme fatigue. Not just feeling tired after a long day. I'm talking about bone-deep exhaustion that doesn't go away no matter how much you sleep. You wake up tired. You're tired all day. You go to bed early and still wake up exhausted. You blame it on stress, work, kids, getting older. But here's what's really happening. Your cells aren't getting the glucose they need for energy. Even though your blood is full of sugar, your body can't use it properly because you don't have enough insulin or your cells have become resistant to insulin. Think about that for a second. You have all this fuel in your system, but your body is starving. It's like having a full gas tank but a broken fuel pump. Your car won't run no matter how much gas you have. That's what's happening inside you. Your muscles are weak. Your brain is foggy. Everything feels harder than it should. And the worst part? You've probably been living with this for so long that you've forgotten what normal energy levels feel like. You think this is just how life is now. But it's not. It's a sign that your body is in crisis. Here's one that catches people completely off guard. Unexplained weight loss. You might think losing weight without trying sounds like a dream come true. But when it happens because of diabetes, it's actually a nightmare. What's happening is that your body can't use glucose for energy, so it starts breaking down muscle and fat instead. You're literally wasting away from the inside. And because this often happens gradually, you might not even notice it at first. Your clothes fit a little looser. People compliment you on losing weight. You feel good about it. Until you realize you haven't changed anything about your diet or exercise routine. This type of weight loss is particularly common in type 1 diabetes, but it can happen with type 2 as well. And it's a sign that your diabetes is already quite advanced. Your body is in survival mode, desperately trying to find energy anywhere it can. If you're losing weight without trying, especially if you're also experiencing any of the other symptoms we've talked about, you need to see a doctor immediately. This isn't a lucky break. This is your body sending out an SOS signal. Now for the 7th sign, and this one is perhaps the most overlooked of all. Tingling or numbness in your hands and feet. You've probably experienced this before. That pins and needles sensation when you've been sitting in one position too long. But what if that feeling doesn't go away? What if it happens randomly throughout the day? What if your feet feel numb even when you're walking around? This is called peripheral neuropathy, and it's one of the most common complications of diabetes. High blood sugar damages the nerves throughout your body, starting with the ones furthest from your heart. The damage usually begins so subtly that you barely notice it. Maybe your toes feel a little tingly sometimes. Maybe your fingers feel slightly numb when you wake up. You shake it off and forget about it. But this nerve damage is progressive. It gets worse over time. Eventually, You might lose feeling in your feet completely. You could step on something sharp and not even know it. You could develop a serious infection and not feel the pain that would normally alert you to the problem. This is how small issues become major medical emergencies. What makes all of these signs so dangerous is how easy they are to rationalize away. You're tired because you're busy. You're thirsty because it's hot. Your vision is blurry because you need glasses. You're peeing a lot because you drink a lot of water. Every single symptom has a perfectly reasonable explanation that has nothing to do with diabetes. And that's exactly why so many people miss the diagnosis until serious damage has already occurred. But here's what you need to understand. These symptoms don't usually appear one at a time. They cluster together. If you're experiencing 2 or more of these signs, the chances that it's just a coincidence are extremely low. Your body is trying to tell you something. The question is, are you going to listen? Or are you going to keep making excuses until it's too late? The good news is that catching diabetes early makes all the difference. When you identify the problem before major complications develop, you can manage it. You can prevent or delay the serious health issues that come with uncontrolled diabetes. You can protect your heart, your kidneys, your eyes, your nerves. But only if you act now. Only if you stop ignoring the signs. So what should you do if you recognize yourself in any of these symptoms? First, schedule an appointment with your doctor immediately. Don't wait for your annual checkup. Don't tell yourself you'll do it next month. Do it now. Second, ask for a comprehensive blood sugar test. This includes fasting glucose, A1C, and possibly a glucose tolerance test. These tests will give you a clear picture of what's happening in your body. Third, be honest with your doctor about all your symptoms. Don't downplay them. Don't leave anything out. The more information they have, the better they can help you. And here's something crucial to remember. Even if your tests come back normal, that doesn't mean you're in the clear forever. Diabetes can develop over time. If you're at risk due to family history, weight, age, or lifestyle factors, you need to get tested regularly. At least once a year, maybe more often if your doctor recommends it. Prevention is always easier than treatment. Always. The reality is that diabetes is an epidemic. Millions of people have it and don't know it. Millions more are pre-diabetic and heading toward a full diagnosis. But it doesn't have to be this way. Your body gives you warnings. It sends you signals. It tries to tell you when something is wrong. The question is whether you're paying attention. Whether you're willing to take those signs seriously instead of brushing them off as normal aging or stress or bad luck. I want you to think about something. What would your life look like if you ignored these warnings for another 5 years? Another 10 years? What complications might develop? What opportunities for intervention might you miss? Now imagine the opposite. What if you took action today? What if you got tested, got diagnosed if necessary, and started managing your health before serious damage occurred? The difference between these two paths is enormous. And the choice is entirely yours. Remember, diabetes is serious, but it's also manageable. With the right treatment, lifestyle changes, and monitoring, people with diabetes live long, healthy, fulfilling lives. But that only happens when they catch it early. When they listen to their bodies. When they refuse to ignore the signs that something is wrong. Don't let fear or denial keep you from getting the help you need. Your future self will thank you for taking action today. Your body is talking to you. It's time to start listening.